trying this again. We just started it, and people could not hear us. So we are going again to see if people can hear us now. So for all those people that are watching, hopefully you come back on. We had 1 million people. No, we had like 13. Oh, we have one. For the person who is Wesley, can you hear us? Wesley, type in if you can. Oh, someone has to open the comment section. Can you open the comment section?
I don't have access to that.
No, just go on the Facebook thing. Go on the live. Oh, maybe I can.
You have to. It's on your thing.
Clay, yes, you can hear us. Wesley, we are talking to you, my friend. Yes, they can hear us. All right, is this Instagram? Are we on Instagram too?
Yes. Instagram too.
Tilt that down. Tilt it just down this way. All right, people, we have Facebook here, Instagram here. So welcome for everybody who is here. Finally, technical difficulties. Because, oh my gosh, technical difficulties here. Because we are physical therapists. We are not audio, visual, even though I'm very visually and audio
that was
cool. It's pleasing. I have no clue what I'm doing with this stuff. So, our first video we started had no sound, so you can hear us. Thank you, Wesley. You're the best. We are 9-0.
1 PT.
We didn't even practice that. Boom. Drop the mic. Drop the phone. We're 901 PT. Sorry, get excited about this stuff. 901 PT. Put a camera in front of me. I get excited and start talking. Say what? What?
Well, the first one.
Oh, it's live. So we're now in physical therapy, and we are figuring this out here with Instagram and Facebook. So if y'all are watching it and all of a sudden it screws up, we seriously apologize. And we'll get better at it the third time. We did it last week. We're going to do it again each Friday during Corona, COVID-19. So we'll be doing this till like 2022, right? Hopefully not. So this is called the 4-on-1 with the 901, in the 901. I think I said that right. Where each week we want to come together live and pick a certain topic and talk about that topic that has to do with our expertise in the field of kind of sports medicine, spine. If you're an athlete, you're active, or you got spine and you have pain, whatever it might be, kind of what we do as physical therapists.
Do you have a spine?
Everybody's got a spine. That's what I mean. You got a spine, you got a spine. It's all inclusive. So we want to kind of just be a resource for information. You're following the questions.
Yeah, I've got access.
Can we go pull up the Instagram live feed?
I've got both of them.
Ah, Jessica's got it. So if we have questions from y'all about what questions as we start talking about the topic today on low back issues and low back injuries, low back pain, if you have questions, please send them in our way. Jessica will read them out to us, and we will do an amazing job of waxing eloquent to help to explain the mysteries of your back issues. Yes, all right here. My lovely wife is now watching. Hey, love. Last time I said my parents were probably watching, so mom and dad, if you're not watching, you should get on this, hopefully. Okay, so today, low back. We have Dwight in the back here. Maybe we need to grab a hose pine too. Last time we talked about neck issues. Today again we're talking about low back. Last time we tried to talk about everything to do with neck pain, and we talked for a long, long time. Hopefully it was helpful. Today we're going to try to narrow the topic a little bit, even though this is a very broad topic about low back pain. It is something that is rampant in our society. I think the research shows that 80% of us at some point in our lives have low back pain and are dealing with it. I know that used to have chronic issues for about 12 to 15 years, injured my back in high school, and just had it for about 10, 15 years after that until I became a physical therapist and started dealing with it. So I've had my fair share of issues. So today we're kind of going to talk about why we have low back pain, why it's something that happens a lot, kind of what it is. We're going to go through the anatomy and hopefully do some explanations of that. We're going to talk about x-rays, MRIs, imaging, Sarah's favorite word. We're going to talk about what those things can mean, what they don't mean, that kind of stuff. And if we have time, we're going to start talking then about what to do about sudden onset of back pain. We can't talk about all the things with back pain, of chronic issues or all different types of things. So we're going to try to pick one real common thing. If you have all of a sudden hurt yourself, you are going to pick up you're going to bend over and wash your hands for the 1000th time for the day, and all that bending over is bothering your back. Or you're at home and you're picking up those kids more than you typically have been, or whatever it might be, and you have sudden onset of back pain, you kind of want to address that. And what we don't address today, we'll talk about it again next Friday, the 411 and the 901. Back pain. All right, so back pain, ladies and gentlemen. By the way, Dr. Jonathan, joined our team this week. So now we have a guy on our team. So I'm really excited to have Jonathan here. Love you, ladies. Ladies, you are awesome. Brilliant. Brilliant. Now we have Jonathan. So that's this new guy back here. You're like, who is this guy back here? Dr. Jonathan Mace has been practicing physical therapy for several years now, and has a lot of experience with back issues himself. Has treated a lot of back issues over the years. And so he's our expert today. Did you know that?
Boom.
You're leading.
I know now.
Jonathan, why do we have back pain so much in our society? All of us, why do y'all think our patients are coming and seeing us with back pain? Why do you think we see this so much? Jonathan, what do you think? Why do you think we have so much back pain? While you do that, I'm going to open my beer. We are not seeing more patients today.
Man, I should have got one as well.
Yeah, it'd be nice if somebody.
So Jonathan, what do you think? Why do you think we have so many back pain? Or Sarah or Jessica, not just the guy in the room.
Not just the only guy.
I think we don't move like we are particularly designed to. So I think that our demands kind of out of life changed and just look different in different societies. And our society sits a lot, and we don't move in the way that I think that we were built to, and I think that we've lost coordination. Just a lot of our just like fundamental movement patterns.
Can I speak to that real quick?
Mm-hmm.
When I had low back pain, my back was really stiff. Once I started working on my back, I can now do. I have to show off. This is your normal, natural movement. Once I started treating my back, I could body roll.
I'm glad he did that because I was not going to do that.
Sorry, I'm done. I just had to say that.
After one sip of beer.
This is my first beer. Friday. Continue.
So I don't know. I think to me that's why. I think that's why a lot of times we encounter back pain. I mean, we get stiff in certain areas. We get tight in certain areas, and so I think that those patterns they just lend themselves. I think that yes, I mean we can have some structural issues. I mean you can sprain something, you can hurt something, you can there's a lot of stuff that you can do. But for the most part, it heals really well if we have the right movements and if we have the balances. And the fact of the matter is that even when we get hurt, then we don't restore those motions. And I think that's where we have pain.
Movement is medicine. Motion is lotion. It's stuff that we say all the time. And yeah, I think we don't move. And I think Sarah mentioned it. We sit so dang much in our society. There was some interesting research study. This is several years ago that I read. But there was I think it was an orthopedic surgeon or a neurosurgeon, I forget the detail, who went and spent 6 months with a group out in South America, a very primitive culture. He then spent 6 months and really studied this culture in Africa, again, a very primitive culture, and wanted to learn kind of more about the orthopedic type things that they deal with. And one of the things that astounded him was there was no word in their language for low back pain. They did not have low back pain. In fact, one of the only persons that he found through these tribes with low back pain was someone who had fallen out of a tree and had, a bad back injury from there. But for the most part, these cultures did not have back pain, right? So we have to ask ourselves, why? Well, it's because they freaking moved all the time, right? They don't sit. So for me, sitting is the damning thing of our society. We sit way too much. And I have people tell me all the time who are 25, 35, 40, and like, you say, man, but I don't sit anymore. Like, I don't sit at all. I'm always up and running around, either working with the kids or their job has them walking all the time. And I'm like, okay, well, what did you do between the ages of 5 and 18? You sat on your butt in school, and I think, again, that starts to lead to this inactivity. It can lead to tightness, leads to weakness. It can lead to stress to our joints and spine. I think that's when things start to maybe, these bad movement patterns can really start to form. It's because we sit so dang much and we weren't designed to do that. And so then I think when we start trying to move, and maybe that's when we can injure ourselves more often. But I think for me, sitting is one of the main reasons why we see so much back issues. What else do y'all think? What other reasons do y'all think that why back pain in our society is such a problem, why it's so rampant? In this case, let's talk about like the biopsychosocial model. So biopsychosocial model, and how this is something that has really been, it's a way that physical therapists in our profession that we have kind of studied, and more of us have been using and applying, as opposed to the bio model, where when we talk about back pain, all we can think about is the biology. What's going on with my nerves, my discs, my ligaments, my muscles, which we're going to get into, but we treated back pain very much biologically only, where we want to look at an x-ray or an MRI or something like that. But what are we learning about pain in kind of the pain science community? There's lots of study in the past decade about what actually is pain, what is it not, and we're learning about how it's not a black and white issue. There's a lot of gray. It's very multifactorial. Lots of things contribute to pain. And so what do y'all think about with our patients in the kind of psychosocial aspect of it, why pain, back pain in particular, can be so rampant and kind of hang around and stuff like that?
I think it's scary. I think that pain is a fear response, and our fear ramps up the pain. So a lot of times, people go straight to, oh, is this something really bad? And yes, that stuff can happen, but it is by and large a very, very small portion of low back pain, right? So much of it is minor and can be treated well. But I definitely think it's scary, and that scary experience changes the way that we move, and it changes the way that we feel about our bodies and our back, and it creates a situation of vulnerability.
Yeah, very much so. What are some other things y'all hear patients say, if they're concerned about a disc injury or?
Yeah, I think what Sarah kind of hit the nail on the head is they're scared. They've heard a lot of bad words associated with back pain, like something is degenerating, or it's slipped disc, or you shouldn't lift anymore, you shouldn't participate in activities that you enjoy, and that can be a little bit frustrating and stressful because you don't really have all of the answers, and that can kind of exacerbate or compound that fear and pain response.
Yeah, and I think that when people come and see us with that fear response and they're not sure, as therapists, that's one of the first things we tackle before we even start looking into, or just in conjunction with looking into the bio aspect of it. We have to address that fear and concern, questions. Heck, guys, that's why we're doing this, because we think that back issues, it's a big deal in our society. It's a problem, and I think a lot of that is because of people don't know about it. People are afraid, and I think that there is, for lack of a better word or way of explaining it, I think in the health community right now, we do a bad job of kind of seeing the complexity of it, and we take it as too black and white. And we talk about our back pain only being this bio thing. Oh, you've got a disc bulge, boom, that's it. That's all you have to know about it. Let's just treat that one disc bulge, and we don't consider the other aspects of it. How would y'all describe, what are some of the things you have to consider besides some of the social aspects, the biopsychosocial approach? What does that mean? Would you say with when it comes to back pain, and how that can be a part of the pain and the problem we're having?
Stress is a huge one. I have a couple people now who have been doing really well, and all of a sudden work is more stressful. They're working more hours, and they're not working tie into not a nice package, but a package that
Yeah.
will increase some back pain symptoms.
I mean, can we get a witness? Can anybody out there relate to the fact of, with all the SHIT that is going on right now with the economy, with all this stuff's happening, you know, we're all trying to figure it out. Me as a business owner, trying to figure out like what's going on. Here's 4 of us, we're all sitting so close to each other. Like we're trying to help each other, we're trying to help y'all, but we're 6 feet apart. Like there's just so much confusion. What's the best decision? I guarantee you that a lot of us are in that same boat. And how many people's, when I say can I get a witness, how many people's back pain or neck pain or shoulder pain has been acting up more in the past 3 weeks, 2 weeks since all this stuff happened, right? It's because stress plays a huge deal. Like socially, I'm stressed and like what's gonna happen? And I've been starting having more neck issues and things that are bothering me. Like I have to understand that the pain that I'm feeling is not, oh, I've got this spot in my neck that's bad. No, it's the fact that maybe I'm overstressed, I'm not sleeping, maybe I'm doing more of this. You know, like those things are contributing to our pain, and it's way more complex. You know, it's not just a simple, it's not just an anatomy, it's not just biology.
I think socially too. I mean, who doesn't know somebody that has back issues, right? Like it's just it's such a common thing.
Thank you, Sergio.
So everybody has kind of a contact point with that, and you know your cousin's third wife's best friend who had to
Third
have
wife? What kind of cousin is that?
I don't know,
Tough
distant,
family.
but
That's stress right there. Third wife? I'm sorry, I love your wife.
But ultimately, the point there is that everybody has some contact point or some horror story of somebody who's
Right,
had this
yeah.
really bad scenario, and not all, like not every case is created equal, right? They're not all the same. But so many times we draw conclusions off of our own pain to somebody else's experience, and you really can't do that, right? Because every experience there is unique. But it's really easy to do when you're worried and you're anxious and you're stressed.
Sorry, go on.
I know you're fine. It's really easy to do that, to draw that conclusion, and that sort of thing.
No, I'm totally agreeing with everything that's been said so far, and boys.
Yeah, totally. So if another thing that I think is part of the social aspect, right? We treat a lot of people who love to work out, love to lift weights, and they have hurt their back, and now all of a sudden they it's hurting too much where they can lift weights, and so they're at home more, right? Crap, again, guys, this is what we're all experiencing. You're not in the gym right now. You're not with your community, whether that's with Iron Tribe or a CrossFit gym or it's your yoga practice with people you love to see every single day, and you're not in that community, right? So when people have back injuries and back pain, if they can't be doing that, that's going to affect them. They're thinking to themselves, am I ever going to get back to this? Will I ever be able to lift the weights that I thought I used to be able to do? Right, as guys, I feel good about myself when I can lift some weights, even though I don't lift heavy weights. And a lot of people are like, that sucks. But for me, I'm like, hey, I'm lifting more weights than I had in the past maybe, and it makes me feel very confident, and I feel good about myself. And so if I can't lift weights and I hurt my back, that's totally going to affect, there's no way that's not going to affect my stress level and thinking like, oh gosh, I'm damaged. All of that murky situation is part of the pain experience that we have, right? And we treat a lot of people with chronic issues that's what we have to deal with, and address all those concerns and get them out on the table and talk to them and address them to help deal with low back pain.
I will say, kind of speaking to that, I also I treat a number of people, and I've heard this so many times, of maybe people even feel a sense of guilt because they're like, I hear like, well, my life is really great, so I know I really shouldn't complain about this, and I know it really shouldn't be a big deal, but I can't go and I can't participate, but I know it shouldn't be a big deal because if you think about it, everything is really great in life. So, but if it's something that stops you from doing what you love, and if it's something that's getting in the way of your life, then it's okay to have that be an interruption. It's okay to let that be a big deal, even if it's not horrible pain, even if it's not stopping you in your tracks and crippling you necessarily. Not everything is that drastic, but I see that, and it's okay to have that experience, and to know that a lot of times there is something that you can do about it. But I feel like I see that of sometimes people even just feel bad of like, oh well, I shouldn't complain complain, or I shouldn't really think it's that big of a deal, but
Right.
it is a big deal to me.
Yeah. So it's a complicated issue, back pain in our society, right? It's complicated, and that's something that, again, we want to share that message with you, that if you've had back surgery and it hasn't helped you the way we thought you thought it was going to be, if you've had injections and it's not changing, and if you've done everything to deal with the bio aspect of it, but you haven't maybe addressed some of these other things, well, then that could be a part of it. It may not be, but it could be a part of it. And so just helping you guys understand, this is not a single factor issue. There's layers to this. Cool? So, we can talk about that all day. Let's jump into the biology of it. We do want to provide some information and education about the anatomy of the spine. You can put your app with the muscles on it. Muscles. So, let's talk about the spine. All right. So, we want to talk about we're going to spend the next hour going through the anatomy. Just kidding. No, I would do that. We want to talk about the biology, the anatomy and the mechanics of the spine. And we're going to talk about the bones and the nerves and the discs. And we're also going to use an app that we have to kind of show you all the muscular system as well. And then we're going to talk about how, like on X-ray, MRIs, things that can show up and kind of shed some light on that. All right? So first of all, let me come close to you guys. Let's talk about the bony structure. So this is our skeleton. This is on the back side. That's the front side, right? If we look at it from the front, we have 5 lumbar vertebrae. So if you've ever had an X-ray, I want to knock my beer over here. Keep that over. If you ever had an X-ray or you had MRI, CT scan, whatever it might be, and they said L5-4, or you have a disc bulge at L3-4, or the nerve pinch is at the L5-S1 nerve, right? So the L stands for lumbar. And this is the 5th lumbar vertebra. There are 5 of them, so we call this the L5, L4, L3, L2, L1. Everything above that is the thoracic spine, up until we get to the neck, which is the cervical spine. So that'll say C6, C7. There's 7 cervical vertebrae. We have people see it sometimes, oh, my C9. I'm like, no, there's not 9 vertebrae. That's not cervical. So there's 7 cervical vertebrae, 12 thoracic, 5 lumbar, and then we have the sacrum, the S. The S, there's our sacrum. The very bottom, the coccyx. If you've ever seen Napoleon Dynamite, the coccyx, Bell broke my coccyx. What was that guy's name? Uncle Rico. Anyways, I digress. That's the sacrum, so that's the S. So if you've ever had SI joint, here is the sacrum, the S. This is I, the ilium, our pelvis. So SI, the SI joint. That's the joint that they're talking about. That can also contribute to back pain. Not near as much as we think it does. Long story short. Okay.
That's
Another podcast. Not a podcast. 411 to 901. All right. So we have 5 lumbar vertebrae. Now I'm coming from the back side. We have kind of this posterior or back side where we have the spine is processed, this tram is processed, the back side of the bone, and then we have the joints. The joints are where one vertebrae attaches into another vertebrae. So if we look right here, right at that spot, that's called the facet joint or facet joint, or if you're from another country, you might call it the zygapophyseal joint. Fun fact. The facet joint, when we bend forwards, if you look right here, it opens up when you bend forwards, closes down. So if I bend backwards, it closes down. If I bend forwards, it opens up. So the facet joints kind of close down, they open up, and there's more space when I bend forwards. Okay? On the front side are the discs. These discs are really nice, robust, thick pads in between the bones that help to provide support, structural support and integrity. They provide cushion, lots of different things there, provide health to the bones. And so there's a disc between each vertebrae. All right? So this is the L5, that's the sacrum. We call this the L5-S1 disc. That's the L4-5 disc. In between the front side and the back side are our nerves. So we'll look closer there. So there's the nerve. You can see that little hole that it comes out of. It's called the foramen. If you've ever been told you have stenosis, that's where they're considering the fact that that foramen, that little circle, is a little bit smaller. Long story short, that can be a problem, but a lot of times it's not a problem. It's just normal, natural part of aging. So we can have stenosis there. But this is where that nerve comes out of the spine. That's part of the spinal cord. And those nerves form together, and they come down here, out to this area. Part of them do, the lower part, and they form, large part of it forms the sciatic nerve and goes into your leg. Okay? So those nerves kind of join, they're called a plexus, and they go into the leg. Some of the ones up higher come more in the front of our thigh. Okay? So that's the anatomy of the bones, the discs, the nerves. The nerves are what supply the sensation, power to our muscles, reflexes, those kinds of things. And on the back side, again, we have the joints. Sarah, you want to show the muscles?
Yes. So then, we've got, all right.
Look up there.
Oh, yeah.
So back up just a little bit. Well, now I can't see down here.
I know. This
Just
is a
kidding,
delicate
Sarah.
balance. Here's our muscular system. So a lot of times, again, kind of like Clay was talking about, we focus on the skeletal system, but the muscular system is so important, and a lot of times it kind of gets thrown to the back. And so if you look here on the most superficial level, like we've got our lats. That's a huge muscle. So it goes all the way from the top of the hip bone up to the shoulder. And you got this, and you've got this really thick fascia here. This thick fascia is so strong, and it helps to support our back, and it helps to give us strength. Underneath here,
So we just took the layer of the lat muscles off. Now we see this.
you start to see, this is the erector spine muscles, and then this is serratus posterior. So you have these muscles that are then coming up around, up the spine. Yep, there we go. So you've got the erector spine muscles that come all the way up, all the way through the cervical region.
Just a point of reference, we're going to highlight one of those erector spinae because we get this question a lot when the people have back pain in the lower back and it's kind of going all the way up into the base of my neck. Y'all look at the length of this one muscle. People a lot of times think, oh, this back that's shooting up into my upper part, I must have a pinched nerve or a disc is bulging. No, like maybe that's happening. That's not the cause of that pain. A lot of times that pain that travels up is that one muscle. It goes all the way up to the base of your neck. Those erector spinae muscles are long and huge.
Mm-hmm. And then as we go, you can see we've got layer upon layer, but then we get to a deep muscle called the multifidus. This is an important muscle, and it helps to basically this muscle is controlling our deep movement at the spine. So it's not necessarily. We used to spend a lot of time focusing on just activating in this one muscle, and the more we find out, it's not about just activating in one muscle. It's in activating.
Yeah, our muscles don't work in isolation.
Right.
They work as a group.
It's about activating them all. But this guy is important, right? Because it does help to control some of the fine movement, particularly rotation and extension at the deep level of the spine. Like the other ones, it also goes all the way up into the neck though too. So, you can have issues at this muscle all the way from the bottom up to the top as well.
And again, let's just look at that, the layers. So there's just the bones, 1 layer, 2 layer, 3 layer, another one, you get a muscle, you get a muscle, you get a muscle, right? That's just the backside, people. Let's go to the front side. If you're freaked out by this, I apologize. Big old diaphragm. It's another part of our core muscles. How we breathe is so important to how that affects our low back pain. Huge muscle that we can tap into to help us with our low back. But that's the diaphragm. Here's the big muscle, the psoas muscle. That's something that we hear a lot of our patients say they have. Oh, I got psoas tightness. All right, I must have a hip flexor problem. That psoas muscle is on the front. We keep looking on the front. You get a layer. Now there's another layer, another layer, another layer. Right? We say all this, right? Because we have a lot of muscles. And Sarah, like what you were saying earlier, people sometimes look so much just to think, well, I've got back pain. And they get so absorbed in that one disc or that one tiny nerve, one ligament. And we forget about all the robustness, your favorite word there,
I do love that.
of the muscle. What were you saying there about that, Sarah?
Really, we have to consider the role of the muscular system, because you have all those separate layers, and each one of those muscles has its own job, right? And it's a beautiful system that works together. So it's just if you take the puzzle apart and only look at one piece of the puzzle doesn't make sense. But it really starts to kind of come in and fit all together once you can look at all of those pieces and how they move. So all of that to say is that the spine and the body is incredibly strong, and we have all these different muscles that work to support it. And if you're struggling and you've had issues, that being strong is so important. And it's not just about your strength of, I work out all the time and I lift all of this heavy weight and that sort of thing. It's not about strength in that capacity. It's about control, right? Can you access all of these different movements? Can you make these muscles fire? Can you control that movement? And a lot of times, even in really strong individuals, that's a loss that you might see.
Yeah, and that's a key part of our treatment, is looking at some of those finer aspects of movement. Like, Jessica, what are some of the things you would look at if someone says, well, I have really big, strong lats? What's an example of a motion of control you're going to look for?
So I'm going to look for their ability to disassociate the pelvis from the low back, and their ability to control that motion and just stack the pelvis on top of the ribs, or the ribs on top of the pelvis to create a more stable core column.
Right, yeah, to disassociate the pelvis from the spine. A lot of times when people move, everything, again, let's go back to my awesome example. I knew you want to see me body roll.
Oh, here it comes.
Boom, disassociation. Okay, I'm going to stop that. But it's my ability. People oftentimes move as one unit, and because they've had back pain for a long time, and maybe been told you have to have good core strength, and everything they do is just here. They know, get the milk out of the fridge, pick the kid up, and there's none of there's no motion there, right? And it's important that, like what Jessica was saying, is that you can figure out how to move your ribs and your spine, your pelvis independently of each other, so that you can learn to move more freely. And when doing that, that's going to help activate that muscular system to provide control, not just brute strength, right?
I like to think about it like the core strength is not just about holding one posture and position. It's not just about bracing. Think about a ballerina, like the way that a ballerina moves. It's such an incredible strong core that happens through these movements, and it's a mobile one, right? So we need both the balance between mobility and good control of all that mobility.
Jonathan, with Van Page, she's asking, since when did Jonathan start working here?
Since this week?
Monday. Since Monday.
Yes!
When's a better time to bring someone on than the coronavirus? Right? He was coughing a lot at his other clinic. They let him go. I said, just come here. Kidding.
Just kidding.
Kidding. Bad joke. Too soon.
Too soon.
All right, so that's some of the aspects of pain, our muscular system, our anatomy system. We are going to finish with talking about how that anatomy relates to disc issues, and maybe MRIs and X-rays, and then maybe if you've had an acute disc injury. So here's our disc. We talked about when you bend backwards, it closes down on the facet joints in the back. And when you do that, you get a little bit of compression on the back side of these discs here. On the front side, it tends to open up a little bit more. When you bend forwards, it puts more compression on the disc in the front in a very nice, natural, beautiful, body is designed to do it kind of way. So flexing, rounding our spine is nice and healthy. I have too many patients who think that you can't ever move your spine. No, it's okay to round your back out. Like, our discs are resilient structures. They're built for it. Now, let's not go crazy and lift 500 pounds in that position, but they're built for that, okay? But a lot of times, when people are concerned about X-rays and MRIs, they've been told they have a disc bulge. What you'll see on an MRI is where this disc, typically on this back, we call it the posterior lateral corner, but on this back corner, might have pushed out that way a little bit, where it might be nice and plump, and then maybe it flattens a little bit, or on the outside it's kind of just pushed out, and a little part of that disc is moving out in that direction. Maybe it happens on just this outside corner. Maybe it happens, can't get to it, but like back in the central area, so like a central bulging. We have a huge, thick ligament on the front side, so that usually, you don't get too many bulges that way. You don't really see that. but that disc can be bulging in that direction. You also might see on an x-ray or an MRI where this disc has gotten smaller, where the space between that bone and that bone is now smaller. So we can say that that disc is smaller, less height, and that can be termed degenerative disc disease, which is a very scary word. So what are the studies out there that talk about people walking around with nerve issues, disc issues, degenerative disc disease, and does that mean it's painful or not?
I guess I can chime in with that one.
Yeah.
A large majority of us are probably already walking around with some degeneration, some arthritis, some disc bulges. Just because they show up on a picture does not necessarily mean that that is why you're hurting, if you are in fact hurting. That can be a pain driver, but take encouragement that, man, a lot of us actually have it. I'm sure if I had an x-ray, sometimes it's not like the outside of how I look with a picture. So if you take a picture of the inside, I mean, the same thing applies. Like, something's going to show up, but don't put all your eggs in that basket. Just because it's there does not mean that's why you're hurting.
Yeah, there's a research study of that, and there's been multiple ones done, where one of them was like, what, 4,000, 5,000 people?
A large group.
It wasn't like 50. They took like 5,000 people who had, they called it asymptomatic, no symptoms, no pain. They pulled them off the street, and they did an MRI, x-rays of their spine. They wanted to see, what do we see, right? And they looked at between like 10, 20-year-olds all the way up to like 80 and 90-year-olds. And they want to see how much stuff do we see, disc bulges, degenerative disc disease, discs being smaller, do we see nerves being pinched? And guess what, people? They found a whole crap load of stuff. I'm almost 40, I'm 38 years old, and in my age group, 40, they found at least half of us have degenerative disc disease, where our discs are a little bit smaller. Or at least half of us, maybe a little more.
Rates starting to increase pretty significantly as early as in your 20s.
Yeah, in your 20s, they started like, and I'm not talking like 10%, we're talking 20, 30% of people had disc bulges in their spine. At my age, maybe 50 to 60% of us had disc bulges, and like 30% of us had pinching of our nerves, where there was pressure, I say pinching, there was pressure on the nerve, either from the disc or just inside this area where behind the facet joints can do that. There could be stenosis. If you are 60, 70 years old, it's like 80 to 90% of you are going, if we x-rayed your back and all of y'all had no pain, then we're going to find in 80% of y'all, you're going to have some form of degenerative disc issue or a disc bulge or arthritis in these joints. So these are people with no pain, y'all. Like, let that sink in. A lot of us, as Jonathan said, are walking around with degenerative spine issues. People call it wrinkles of the spine, right? We all get wrinkles on our face. Not me, I'm just kidding. I have plenty of wrinkles, right? So we have wrinkles on our spine as well. It's just part of our aging process. So a lot of our patients are told, oh, you have L4-5 disc bulge at this specific spot, and so that's what's causing our pain. When in fact, we go to assess that person, we find out what's going on with the biopsychosocial model, we get into the weeds of those, we ask questions, we check their motions, we check their muscles, that Sarah was showing us, and we find problems are in that area, and their pain has nothing to do with the disc. You know, maybe they've had steroid injections to help decrease inflammation, and with our assessments and our thorough assessments, we find there is no inflammatory response of their nerve. This will stretch the nerve that goes into the leg, the sciatic nerve, by doing leg tests and nerve stretches, and they're fine. But people have been paralyzed by the fact that they feel like, oh, I've got sciatica or a pinched nerve, and they get really scared and they don't want to move, when in fact, that's not what's causing their pain at all, right? And so that's something that, like, if you have questions about that, like you've had an image, an x-ray, an MRI, and it's showing this stuff and it's not getting better, or they're doing treatment for your disc bulge and it's not helping your pain, well, y'all, like, a lot of times, that's not what the source of the pain is. Even though the MRI might show it, you might be one of the 80% of 65-year-olds that have a disc bulge. And that doesn't mean that's what's causing your pain, right? So that's a huge aspect of this that you have to understand that, again, everything we said earlier, there's way more things there's way more stuff that goes on to this pain than just what you see on the x-ray and the MRI. Cool? All right, we're going to wrap it up with that. We have been talking long enough. What we're going to do next time is we're going to talk about common pain complaints of the back. So if you've injured your back suddenly, we'll get into that the next time. maybe if you injured your back with lifting weights, maybe you have back pain with running. We'll start to tease that out more next Friday, right around this 3 o'clock time. So if you have questions, shoot them our way. You can go on our Facebook page, 901 Physical Therapy, or Instagram, 901PT. Send me an email, clayj@901pt.com, right, with your any questions. Reach out to us. We are still here to help, right? Stuff is craziness right now, but we're still here to help, and we're doing this because for one thing, we're not seeing patients as often as you are on Fridays, and we want to take this time to still be a help to our community here in Memphis. And so please reach out to us. Please use us as a resource. We want to spread the gospel of movement and help you get over this back pain if you have that. Cool. Thank y'all for joining us. Friday night, Friday afternoon.
Happy Friday.
Cheers to you. Enjoy happy hour.
Just another day.
Yeah.
Thanks. Yeah.